Lupus may develop in response to a number of factors. These may be hormonal, genetic, environmental, or a combination of these. 1. Hormones. Hormones are chemical substances that the body produces. They control and regulate the activity of certain cells or organs. Hormonal activity could explain the following risk factors. Sex. The U.S. National Institutes of Health note that females are 9 times more likely to have lupus than males. Age. Symptoms and diagnosis often occur between the ages of 15 and 45 years, during the childbearing years. However, 20% of cases appear after the age of 50 years, according to Genetics Home Reference. As 9 out of 10 occurrences of lupus affect females, researchers have looked at a possible link between estrogen and lupus. Both men and women produce estrogen, but women produce more. In a review published in 2016, scientists observed that estrogen can affect immune activity and induce lupus antibodies in mice that are susceptible to lupus. This may explain why autoimmune diseases are more likely to affect women than men. In 2010, researchers who published a study on self-reported flares in the journal Rheumatology found that women with lupus report more severe pain and fatigue during menstruation. This suggests that flares may be more likely at this time. There is not enough evidence to confirm that estrogen causes lupus. If there is a link, estrogen-based treatment could regulate the severity of lupus. However, more research is necessary before doctors can offer it as a treatment. 2. Genetic factors. Researchers have not proved that any specific genetic factor causes lupus, although it is more common in some families. Genetic factors may be the reason why the following are risk factors for lupus. Race. People of any background can develop lupus, but it is 2 to 3 times more common in people of color, compared with the white population. It is also more common in Hispanic, Asian, and Native American women. Family history. A person who has a first or second degree relative with lupus will have a higher risk of developing it. Scientists have identified certain genes that may contribute to the development of lupus, but there is not enough evidence to prove that they cause the disease. In studies of identical twins, one twin may develop lupus while the other does not, even if they grow up together and have the same environmental exposures. If one member of a twin pair has lupus, the other has a 25% chance of developing the disease, according to a study published in Seminars in Arthritis and Rheumatism in 2017. Identical twins are more likely to both have the condition. Lupus can happen in people with no family history of the disease, but there may be other autoimmune diseases in the family. Examples include thyroiditis, hemolytic anemia, and idiopathic thrombocytopenia purpura. Some have proposed that changes in the X chromosomes might affect the risk. 3. Environmental agents, such as chemicals or viruses, may contribute to triggering lupus in people who are already genetically susceptible. Possible environmental triggers include smoking. A rise in the number of cases in recent decades may be due to higher tobacco exposure. Exposure to sunlight. Some suggest that this may be a trigger. Medication. Around 10% of cases may be drug-related, according to Genetics Home Reference. Viral infections. These may trigger symptoms in people who are prone to SLE. Lupus is not contagious, and a person cannot transmit it sexually. Gut microbiota. Recently, scientists have been looking at gut microbiota as a possible factor in the development of lupus. Scientists who published research in Applied and Environmental Microbiology in 2018 noted that specific changes in gut microbiota feature in both people and mice with lupus. They call for more research into this area. Are children at risk? Lupus is rare in children under the age of 15 years unless their birth mother has it. In this case, a child may have lupus-related heart, liver, or skin problems. Infants with neonatal lupus may have a higher chance of developing another autoimmune disease later in life. Symptoms. The symptoms of lupus occur in times of flare-ups. Between flare-ups, people usually experience times of remission, when there are few or no symptoms. Lupus has a wide range of symptoms, including Fatigue, a loss of appetite and weight loss, pain or swelling in joints and muscles, swelling in the legs or around the eyes, swollen glands, or lymph nodes, skin rashes, due to bleeding under the skin, mouth ulcers, sensitivity to the sun, fever, headaches, chest pain upon deep breathing, unusual hair loss, pale or purple fingers or toes from cold or stress, Raynaud's phenomenon, arthritis. Lupus affects people in different ways. Symptoms can occur in many parts of the body. Effect on other body systems. Lupus can also affect the following systems. Kidneys. Inflammation of the kidneys, nephritis, can make it difficult for the body to remove waste products and other toxins effectively. Around 1 in 3 people with lupus will have kidney problems. Lungs. Some people develop pleuritis, an inflammation of the lining of the chest cavity that causes chest pain, particularly with breathing. Pneumonia may develop. Central nervous system. Lupus can sometimes affect the brain or central nervous system. Symptoms include headaches, dizziness, depression, memory disturbances, vision problems, seizures, stroke, or changes in behavior. Blood vessels. Vasculitis, or inflammation of the blood vessels, can occur. This can affect circulation. Blood. Lupus can cause anemia, leukopenia, a decreased number of white blood cells, or thrombocytopenia, a decrease in the number of platelets in the blood, which assist in clotting. Heart. If inflammation affects the heart, it can result in myocarditis and endocarditis. It can also affect the membrane that surrounds the heart, causing pericarditis. Chest pain or other symptoms may result. Endocarditis can damage the heart valves, causing the valve surface to thicken and develop. This can result in growths that can lead to heart murmurs. Other complications. Having lupus increases the risk of a number of health problems. Colon infection. Infection becomes more likely because both lupus and its treatments weaken the immune system. Common infections include urinary tract infections, respiratory infections, yeast infections, salmonella, herpes, and shingles. Bone tissue death. This occurs when there is low blood supply to a bone. Tiny breaks can develop in the bone. Eventually, the bone may collapse. It most commonly affects the hip joint. Pregnancy complications. Women with lupus have a higher risk of pregnancy loss, preterm birth, and preeclampsia, a condition that includes high blood pressure. To reduce the risk of these complications, doctors often recommend delaying pregnancy until lupus has been under control for at least 6 months. If you like more video, just share and subscribe on this channel. Thank you.